Hi, I'm Zach Fagenson with Miami Today, and I'm here at Mount Sinai Medical Center on Miami Beach for an interview with the center's president and CEO, Stephen Sonenreich. Mr. Sonenreich joined the center in 2001 after about 5.5 years at Cedars Medical Center. However, he started his career at Mount Sinai nearly 20 years before. When he returned, the medical center was faced with serious challenges. However, through management overhauls and serious changes, he brought it back to profitability and is now ready to lead it through all the changes healthcare reform will bring.
Well, Mount Sinai is one of only 2 teaching hospitals in this community, and it's become rather vogue lately, for many hospitals to call themselves teaching hospitals. But at the end of the day, by state statute, there are only 2 teaching hospitals in Miami-Dade County, and that's Mount Sinai and Jackson Memorial Hospital, and we've been at that, for the better part of a half a century, and so, being a teaching hospital is something that's very special to us, and it's been part of our mission since the inception of Mount Sinai Medical Center 60 years ago. We have a wide range of services here, essentially every medical and surgical specialty. We have particular centers of excellence in cardiovascular disease and minimally invasive surgery, cancer, orthopedics, and rehab. In addition to our main campus, we have some satellite installations. We have a 55,000 square foot building in Aventura, which has the only freestanding emergency department in the region, where we will see 15,000 patients this year. We also have a full range of diagnostics there, a cancer center, and approximately 40,000 about 40,000 square feet of space that many of our medical staff have their offices there. We have a primary care center in Key Biscayne. We're about to open a cardiology and internal medicine office in Hialeah. Mount Sinai has been challenged by the demographics of Miami Beach, which have changed dramatically over the last 20 years. This used to be very much of a retirement community, and now it's a very young community. In fact, 20 years ago, there were 4 hospitals in Miami Beach, and now there's only 1 hospital in Miami Beach, obviously Mount Sinai. And so the demographic impact of the change in Miami Beach, is significant and continues to be a significant challenge, which is why we have a hub and spoke strategy, and we're trying to put out as many spokes as possible around the community to support this hospital. I was thinking about, I don't know how much you want me to talk, because I could talk forever. Is that I was thinking about this interview, and I think that one thing that I find very interesting is that there are only 3 hospitals in all of Miami-Dade County that have had the same consistent structure leadership for the last 60 years. Mount Sinai, Baptist Hospital, and Jackson, and we know that Jackson's structure is probably about to change. So when you look at the fact that out of all of the hospitals in Miami-Dade County, and I think that there's roughly 40 hospitals, that only 2 hospitals have consistently had the same leadership, the same mission, the same structure for the last 60 years, that's remarkable, and I think that that's a remarkable commitment that the board and the medical staff have made to the Mount Sinai Medical Center mission, of being an academic medical center. The number one thing that is on our drawing board for the future, is constructing new operating rooms and a new patient tower. And that's something that we've been talking about for some time here, and we'll continue to try to find a means to get that accomplished in the next 3 to 5 years.